Hi, this is Pat Sharp with Neuroeducation, and today I'm going to be talking briefly about anxiety disorders in adults. Their causes are pretty typically, as you'd imagine, both, outside kind of things that have happened to you as an adult or a young child even that have carried into your adulthood, or something going on inside neurologically that you're kind of pre-wired to be oversensitive, overreactive to stressors in your world. The traumatic ones are more common in adults just because you've lived longer and you've experienced more things. So it can be anything from abuse or witnessing or being in a severe accident of some kind. All the folks from the people that are involved in services, like, our soldiers, our service people, our policemen. I mean, your lives are set up to be more stressful, and some jobs are way more stressful than others, and a lot of that depends on your work environment, and that can also trigger bona fide anxiety disorders. The bottom line is this very extreme and persistent overreaction to what you perceive to be a threat. Whether or not it comes true is immaterial. It's the feeling that it's going to come true. So the good news is it is very treatable. Anxiety disorders are one of the most treatable mental health disorders there are. And sometimes medications can help with that. Now, the prevalence is not as much as it is in teens. It drops off a bit. It's only about 18% of all U.S. adults are diagnosed with some form of an anxiety disorder. But of that 18%, 22% of those folks are classified as severe anxiety, and that is very life-impairing. The average age of onset is about 31. It keeps dropping to a younger age over the years. I've been at this for 41 years, and I can remember that it used to be more around the 40s and 50s that it was more prevalent for an onset to happen. It's not a temporary feeling. It's long-lasting, and it can get worse over time if you don't get treatment. So treatment is certainly advised. Now, there's lots of different varieties of anxiety. The GAD, or generalized anxiety disorder, is the most common, and it's generalized. I mean, a collection of different things can trigger off anxiety. Or there can be very specific phobias to, like, for example, snakes, or even butterflies, or heights, or being stuck in spaces. And now we're kind of getting into the agoraphobia phobia kind of things where you're fearful because there's no quick escape, like in a crowded mass of people. Like perhaps that explains why some people just really don't like to go to Hoop Fest, the number one big 3-on-3 basketball tournament that takes place in Spokane every year. Or another one is Bloomsday, which is a big road race where there's just thousands and thousands of people. Some people just do not like to get into that kind of an environment. And that doesn't mean necessarily that you have an anxiety disorder, but at a severe level where you couldn't tolerate it at all, and or likely you couldn't tolerate being in a closed elevator that you felt like you couldn't get out of if it quit, or a plane or a bus or being on a bridge or being out in some remote area. All of those things fall into that agoraphobia kind of category, and they are very treatable with cognitive behavioral treatment. So social anxiety disorder is another one where you just you get extremely anxious in any kind of a social setting, and it's not just shyness; it's well beyond that. And then, of course, panic disorder is panic attacks are absolutely no fun. You totally, for real, feel like you're dying or you're about to die. It is excruciating, and that is always you should seek treatment if you have those. Now, the common features in all anxiety disorders are three things. There's excessive fear, there's anxiety, and there's avoidance. And the avoidance can either be active avoidance or passive. Like an active example would be this excessive hand washing because you don't want to get contaminated. So you're doing something actively. But the passive kind is you don't do something for fear of what's going to happen. Like you don't want to leave your home for fear you might have a panic attack. And of course, anxiety is any anticipation of a future threat, whether it's real or imagined. And then the excessive fear is this response to what is happening right now, an immediate threat, whether, again, it's real or imagined. So as of 2013, kind of the two top categories of anxiety disorders used to be obsessive compulsive disorder, where you didn't feel safe unless you did something. It was compulsive, you had to do it right now, and it was obsessive. Every time something was threatening to you, you would have to do this thing to make it feel safe. And I remember treating a young boy who was, he was probably 20, an adult, but still he couldn't go into his home without this little sequence of things he had to do obsessively to feel safe going into his home. And that was very easily treatable, and he laughed about it later, that it took such a hold on his life. And PTSD used to be also diagnosed under that same kind of general anxiety disorder as a specific kind of anxiety, but now they have their own classification in the Diagnostic and Statistical Manual that mental health professionals use for making diagnoses. We all pretty much agree that they're very closely related to anxiety, if not actually just another form of anxiety. Now, for the diagnosis, you need a qualified mental health professional to evaluate your symptoms. And that just means sitting down and talking with somebody who knows about these things, not your next door neighbor necessarily, because they may not know, and they may have their own opinions, which may not have any basis in research. Anyway, and they'll look at your history over the last 6 months. In order to make a diagnosis, it has to have pervaded for about 6 months or more. And then they'll rule out other causes that might be triggering what looks like anxiety, but it isn't really anxiety. It may be some other psychiatric disorder, or it may be substance abuse. And they'll determine the level of the impairment that's having on your functioning in life in general. Now, the good news is, like I said before, treatment for anxiety disorders is extremely successful. Most people improve significantly with therapy. And sometimes we need to add medications to that. But in our clinic at Neuroeducation, we don't start with the medications. We start with the behavioral management treatment. And then if that's not enough, then we consider having you talk with your doctor about medications. And there's other supportive treatments as well that you can get from mental health folks. And that's eye movement desensitization, or exposure therapy, or mindfulness meditation, or psychoeducation, just learning more about it, understanding biologically what is going on, why am I doing this, and then of course relaxation techniques. And then finally, I've got 2 really good resources for you to check out now to find out more about anxiety before you probably call a mental health counselor, or you might be convinced and you're just going to call now. But at any rate, this website, the first one that I've listed, is just a wonderful resource of websites, blogs, books, movies, and documentaries about anxiety disorders. And then the second one is the kind of the gold standard of ideas, information, research about anxiety in America, and it's called the Anxiety and Depression Association of America.org, or ADAA.org. So thank you for listening. I wish you all the best. If you call Neuroeducation for some help, we'd love it. Or call any mental health counselor that gets recommended to you. It's worth finding out about. Trust me.